Hello, my name is Jasmine Kim, and today we'll be discussing and investigating maternal mortality across the globe. In order to investigate how different nations manage the global public health problem of maternal mortality, we must immerse ourselves in each country. Today we'll be traveling to 3 different countries, first the United States of America, then the Federal Republic of Germany, and finally the Republic of Guinea. Before we take off, let's go over a brief overview. Maternal mortality refers to when mothers die as a result of complications during and following pregnancy. All women need access to high-quality care. Most maternal deaths are preventable as the healthcare solutions to manage complications are well known. Poor women in remote areas are the least likely to receive adequate health care. There are a multitude of factors that prevent women in these areas or any other area from receiving or seeking care during pregnancy. I have some listed below. The US is ranked #1 internationally in GDP and spends more on healthcare per person than other wealthy countries. The benefits of that can be seen through the large range of medical specialists. However, each individual spends way more on healthcare than other countries, which decreases access to care because some people simply cannot afford it. The maternal mortality rate for 21 was 32.9 deaths per 100,000 live births. The maternity care coverage is not expansive enough. And additionally, Black women, regardless of levels of income and education, have a higher MMR than white women. There's a gap in care that is occurring that is hindering Black women. Research findings found that patients are open to screening for substance abuse, which can improve access to treatment for mental health and substance abuse in mothers. The White House also released a plan for increasing maternal health services. However, the causes of maternal mortality are very complex and multidimensional and involve resolving structural inequalities. Germany is ranked #4 internationally in GDP, and the defining element of Germany's healthcare system is universal healthcare coverage for all citizens. It is possible to opt out of state-provided health insurance, which does weaken solidarity, and in addition, the separation of ambulatory and inpatient care can hinder the patient's treatment. The maternal mortality rate for 2020 was 4 deaths per 100,000 live births. The maternal mortality ratio in Germany has remained stagnant over the last 20 years, and this is most likely due to Germany's socialized healthcare, which is available to all documented residents, including refugees. Germany's wide dissemination of prenatal care is a strong contributing factor in the stabilization of the MMR. However, there is a substantial need for systemic training pathways because even in a high-income country, there is a need to focus on teamwork and communication within healthcare providers. Our final destination today is the Republic of Guinea. Guinea is ranked 126 internationally in GDP, and as the center of the largest Ebola outbreak in history, Guinea's healthcare system has improved to address public health threats. However, Guinea's healthcare system is characterized as weak, with high mortality levels among vulnerable groups. The maternal mortality rate for 2020 was 553 deaths per 100,000 live births. Around 70% of maternal deaths worldwide happen in this region. This predominance reflects the glaring inequalities in access to care and even so to quality in care in low-income countries. The MMR in Guinea has improved significantly from 2000, going from 971 deaths per 100 live births to 553. However, the sparse healthcare coverage and low health literacy rate makes it difficult for the population to have access to hospitals, doctors, and health education. The 3 countries we have traveled to today have vastly different MMRs. Despite disparities in their healthcare systems, the most common causes of maternal mortality remain the same. This demonstrates how even across vastly different healthcare systems with different levels of technology and accessibility, the complications that come with giving birth have not been eradicated. All 3 countries use some combination of public and private health insurance. There are criticisms saying that the public insurance system in the US doesn't serve the healthcare needs of the people, and Germany widely uses public insurance and spends less of their GDP on healthcare expenditures than the US does. Guinea mainly uses public insurance, however, access to healthcare facilities and services is limited. Let's go over some of the souvenirs that we've collected. These souvenirs represent important cultural and societal characteristics that influence the MMR. From the US, we have an empty wallet. This symbolizes how women living in high poverty areas have twice the risk of dying from childbirth. Additionally, systemic racism in the US perpetuates the cycle of poverty. Up next from Germany, we have a German jigsaw puzzle. Each piece represents a component of the healthcare system as well as all the payers. When assembled, it displays the symbolic interconnectedness and accessibility of healthcare services in a socialized system. Finally, from Guinea, we have a blank canvas. The canvas represents the lack of women's clinics. Majority of the medical facilities are mixed gender, and women feel uncomfortable giving birth in these circumstances. This is why many women in Guinea choose to give birth at home with no healthcare providers. As we conclude our journey across the landscapes of maternal health, it becomes evident that the challenges and triumphs are as diverse as the countries themselves. These findings underscore the multifaceted nature of maternal health challenges, transcending borders and cultures. So, bon voyage to your own journey in the realm of global health advocacy, where every step brings us closer to a world where maternal mortality is an anomaly and not a reality. Thank you for joining and listening. Have a good one.